Today's lesson is on scatter radiation and how we control it. When taking X-rays, scatter radiation is produced due to the X-ray beam's attenuation and reduction in strength by the patient's matter. This lesson will closely examine the production of scatter radiation and the factors that influence its formation. When X-rays are absorbed in the body, their energy is scattered or converted into new scatter X-rays. Three types of interactions occur when radiation is absorbed by matter: coherent scattering, the Compton effect, and the photoelectric effect. Now let's get started.
Coherent scattering is also known as Thomson scatter. Because coherent scattering occurs in very low energy ranges and outside the usual range for diagnostic imaging, this interaction has no significance to our daily work. It is mentioned here only to demonstrate that at very low kilovolts peak, kVp levels, there is an interaction in the body.
The Compton effect occurs at energy levels throughout the diagnostic range of 40 to 125 kVp. Compton scatter travels in all directions and is termed backscatter if directed back toward the X-ray tube. Most of the scattered photons will scatter in a more forward direction. As the kVp increases, Compton interactions are increased. The incoming X-ray photon interacts with an outer orbital electron of an atom, removing it from the atom called ionization, and then proceeds in a different direction. The majority of this photon's energy is converted into a new photon of scatter radiation. Photoelectric interactions are less prevalent in the diagnostic energy range than Compton interactions. The likelihood of a photoelectric interaction is determined by the kVp level and the electron binding energy of the atom in which the interaction occurs. In a photoelectric interaction, the incoming photon from the primary beam collides with an inner orbital electron of an atom. The photon is totally absorbed in the process and creates an absorbed dose in the patient. The electron's departure leaves a hole in the orbit, which is filled by an electron from an outer shell. The difference in binding energy between the two shells is emitted as a new X-ray photon. This photon is referred to as a characteristic photon and is considered secondary radiation because it is radiation actually produced in the body. The photon will have a new direction. Its energy will be less than that of the primary photon. Photoelectric interactions are less prevalent in the diagnostic energy range than Compton interactions. The likelihood of a photoelectric interaction is determined by both the kVp level and the electron binding energy of the atom in which the interaction occurs.
The radiographic effects of scatter radiation creates fog that reduces the spatial resolution's contrast and visibility. As you can see, the image on the left is blurrier than the one on the right. Uncontrolled scatter causes decreased contrast. Factors that affect the quantity of scatter fog depends on four primary factors that directly affect the quantity of scatter radiation fog on the radiograph: tissue volume, kilovoltage, the density of the matter, and field size. First, let's talk about how the volume of tissue affects the amount of scatter radiation produced. The thicker or larger the body part is, the greater the scatter and the fog. Like my instructor told me once, more matter, more scatter. Kilovoltage also affects scatter with higher kVp, causing higher penetration that results in more scatter radiation fog. The density of the absorbing matter: the denser the body part, the lesser the scatter. Remember the field size adjusted by collimation. When the X-ray field area exposed at one time is made larger, scatter radiation fog also increases.
As shown before, the production of scatter radiation during an exposure results in fog on the radiograph. It does not strike the IR in a pattern that represents the subject, and it contributes nothing of value to the image. This fog produces an overall increase in radiographic density. Here you can see the apparent fog on the right X-ray. The result is also a reduction in radiographic contrast that make it harder to see. Although increased density in the darker areas of the image is barely noticeable, areas that would otherwise be bright or white will instead be gray because of the fog. The intermediate gray tones will appear more similar to each other, which makes it difficult to distinguish recorded detail within those portions of the image that have similar tissue densities. In other words, scatter radiation creates fog that reduces both contrast and the visibility of the spatial resolution. This makes it difficult to see the tissues that are next to each other, which makes it difficult to determine any potential fractures on the targeted body part. Now let's talk about how we go about controlling scatter radiation fog. Scatter radiation fog becomes increasingly objectionable as the thickness of the subject increases. The principal method for reducing scatter radiation fog is by using a radiographic grid. A grid is used when the body part becomes greater than 10 to 12 centimeters in thickness, or the KVP settings are greater than 60. Remember that criteria, because you will need to know when to use a grid to help control the possibility of radiation fog ruining the X-ray image. A grid is a device placed under the table between the patient and the IR. It looks like a thin metal plate constructed of tiny, tissue-thin lead strips placed on the edge. The lead strips are held in place by a radiolucent interspacing material, usually aluminum. Because they are aligned to the X-ray beam, the lead strips tend to absorb scatter radiation while permitting remnant radiation to pass through. Grids for general purpose use are called focus grids because the lead strips are aligned in the direction of the diverging primary X-ray beam. The grid ratio. The relationship between the height of the lead strips and the width of the spaces between them determines the effectiveness of a grid. Common grid ratios and their applications are between 5 to 1, 8 to 1, 12 to 1, and 16 to 1. The applications are used with grid cassettes, general purpose, and high kilovoltage radiography. The number of lead strips per inch is called the grid frequency, and grid frequencies range from 60 to 196 lines/inch. The grid radius is the distance at which the primary X-ray beam is parallel to the focused lead strips of the grid.
Because the grid absorbs some useful radiation, the X-ray includes an image of the grid itself. Grid lines that appear on the image can reduce recorded detail. Two methods are used to prevent grid lines: the use of a moving grid or the use of a grid that has a very high frequency. A moving grid, known as a bucky, moves the grid during the exposure and blurs the image of the grid lines so that the grid image is not visible on the film. A stationary grid with closely spaced lead strips with high grid frequency made to be extremely thin is used to avoid grid lines on images. Focused grids are designed to allow the passage of radiation aligned with the lead strips. Any misalignment of the primary X-ray beam will result in grid cutoff. This is a consequence of using grids incorrectly. Grid cutoff is an undesirable absorption of primary X-ray beams by grid strips, preventing useful X-rays from reaching the image receptor. It appears as visible grid lines and decreased radiographic density on the side of the image. Grid cutoff occurs when the grid is tilted, when the X-ray beam is angled across the grid, when the grid is reversed, when the source image receptor distance, SID, is outside the focal range of the grid, or when the X-ray beam is off-center to one side of the grid. Grid cutoff is prevented by ensuring that the X-ray beam is always correctly aligned with the center of the grid at the appropriate distance. Using the correct angle when aligning the X-ray beam is always crucial to achieve the best viewable X-ray images.
To summarize, when diagnostic X-rays are absorbed by matter, they are scattered, forming scatter and secondary radiation by means of coherent scattering, the Compton effect, or the photoelectric effect. The greatest quantity of scatter formed during routine radiography is caused by the Compton effect, which scatters photons in all directions. This scattered radiation causes fog on the radiograph, decreasing radiographic contrast and decreasing the visibility of detail. The fog level becomes objectionable when the thickness of the subject is greater than 10 to 12 centimeters. Then use a grid. Scatter radiation fog is controlled primarily by using either a stationary grid or a moving grid device called a bucky. The grid ratio indicates the efficiency of the grid in cleaning up scatter radiation and the precision with which the X-ray beam must be aligned with the grid. When the X-ray beam and the grid are not properly aligned with each other, grid cutoff results. Other means for reducing scatter radiation fog include reducing the field size and decreasing KVP.
Thank you for joining us today as we went over how scatter radiation negatively affects the X-ray image.
Modern technology makes scatter radiation fog an issue that we can prevent fairly easily if we know what causes it and what to use to prevent it. Keep studying, and we will see you on the next lesson.
Keep up the good work and rewatch the lessons as many times as you want to gain a better understanding of how X-rays work. Take care and happy studying!